My name's Jennifer Durso, and I'm the Tobacco Prevention Specialist at the Leon County Health Department, and I'm thrilled to be here this morning to highlight two key prevention messages in the 95210 Health by the Numbers initiative. 0 is the number with two messages behind it, so it's one of my favorites. 0 reminds us to eliminate sugary sweetened beverages and replace them with water and low-fat milk. Also, it reminds us to eliminate tobacco in all forms. Our community acknowledges the importance of this message in a variety of ways. Through resources like the Health by the Numbers website, the Tallahassee Democrats Weekly Focus through the TLH Wednesday local section highlighting 95210, the new 95210 tracking system accessible through the Whole Child Leon website, a forum has been created for families and individuals to track their daily habits. Our community's inclusion of the Zero Tobacco message in the 95210 initiative really sets us apart. Tobacco prevention, education, and cessation resources abound through community partners, and you will hear about those today. There is strength in numbers, and in Tallahassee, those numbers are 95210. Our community's value for zero tobacco use and secondhand smoke exposure is reflected in the 95210 message. But as research shows is so critical for real change, it is also reflected in the commitments being made by leadership in our schools, community-wide, at home, by our families, and in local work sites by employers. With that, it is my pleasure to introduce one of those committed leaders in our schools, Superintendent Mr. Jackie Pons.
Thank you. It's great to be here at Leon High School. When we talk about 95210, we're talking about an entire community. And I think it's very important in the school system that we lead by example, that we need to make sure that our children are doing what they need to do so that they're healthier. And we know if they're healthier, they're going to perform better in our schools, and they're going to also be the role models that take over where we are today and lead this entire community. I want to recognize Sheila Costigan. She's here with me today for what she's doing with wellness and through our Leon Foundation and for childhood obesity and things that are so important to our entire population. And as the leader of the school system here in Leon County, I think it's important that we challenge our students every day to be healthier, to lead by example, and to make sure that we're not using tobacco in any form, and that we're going to create the healthier society that we have right here in our community. At this time, I want to introduce an individual that's been leading our entire community, someone that's in our schools reading with children and that's leading this 95210 campaign, our great mayor, Mr. John Marks.
Thank you very much, Jackie. You know, we have a great city, but we have a great city because we have some wonderful leaders, and I want to take this opportunity to thank Jackie for his leadership as superintendent of schools. I just asked Jackie and the president, Mr. Epling, how the school year is going, and they say it's going off to a great start. Give it time, though, Jackie. You got to we'll see what happens. You know, the 0 in 95210 message encourages families to start talking about the dangers of tobacco early. This is a proven method of tobacco prevention. Let me just give you an example, a personal example. I smoked at one time. When I was in high school and through college, I smoked. I quit. I can tell you almost to the day that I did it. It was at least 36 years ago. And the reason I know that is because that's when my son was born. And I couldn't imagine myself holding a baby in my hand and a cigarette at the same time. So I quit cold turkey at that time. And I think now the message has to be to our students that that is what they should do. Don't even start under any circumstances. So, and our parents and community are using the 95210 message, in this case, 0 again, to continue the conversation and talk about cutting back on sugary drinks and how doing so can help control your weight and lower risk of type 2 diabetes, as well as many other potential diseases. So with that, we have a proclamation related to this that I'd like to read at this point in time. Whereas September 2012 was National Childhood Obesity Awareness Month, and whereas during the past 4 decades, obesity rates have soared among all age groups, increasing more than 4-fold among children ages 6 to 11, whereas 31.8% or 23 million children and teenagers ages 2 through 19 are obese or overweight, a statistic that health and medical experts consider an epidemic. Whereas significant disparities exist among the obesity rates of children based on ethnicity and economic status, and whereas the financial implications of childhood obesity pose a financial threat to our economy, healthcare system, carrying up to $14 billion per year in direct health care costs, with people in the United States spending about 9% of their total medical costs on obesity-related diseases. Whereas obesity, young people have an 80% chance of being obese adults, and are more likely than children of normal weight to become overweight or obese adults, and therefore more of a risk for associated adult health problems, including heart disease, type 2 diabetes, sleep apnea, stroke. Oh, okay. Okay. Sleep apnea, stroke, several types of cancer, and osteoarthritis. And whereas due in part to the childhood obesity epidemic, 1 in 3 children and nearly 1 in 2 minority children born in the year of 2000 will develop type 2 diabetes at some point in their lifetime if current trends continue. And whereas some consequences of childhood and adolescent obesity are psychological and can hinder academic and social functioning and persist in adulthood, whereas participating in physical activity is important for the children and teens, as it can have beneficial effects not only on body weight, but also on blood pressure and bone strength. And whereas proper nutrition is important for children before birth and through their lifespan, as nutrition has beneficial effects on health and body weight and is important to the prevention of chronic diseases, whereas childhood obesity is preventable, yet does not appear to be declining. Whereas public, community-based, and private sector organizations and individuals throughout the United States are working to decrease childhood obesity rates in the United States through a range of efforts, including educational presentations, media campaigns like this one, websites, policies, healthier food options, and great opportunities for physical activity. Now therefore, I, John R. Marks, by the power vested in me as mayor of the city of Tallahassee, Florida, do hereby proclaim the month of September 2012 as Childhood Obesity Awareness Month. We proclaim this in the city of Tallahassee and encourage organizations, localities, schools, nonprofit organizations, businesses, and the people of our city to observe the month with programs and activities that promote healthy eating and physical activity and increasing awareness of childhood obesity among individuals of all ages and walks of life. A lot to say, but a lot of important things to say. And I can't emphasize it more. We need to do this, and we shall do this. We will work hard and continue to work hard. Now, with that, I'd like to introduce, and here's this title. You ready? The interim Deputy Director for Health and Deputy State Health Officer for Children's Medical Services for the Department of Health, Mr. Dennis Kukrow. Mr. Kukrow.
Thanks very much, Mayor Marks. I really appreciate the opportunity to be here and to represent the Department of Health along with Dr. Homer Rice. I think that all of you here know the kinds of problems that we're dealing with today, and I'd like to thank all of you who are here, certainly especially Superintendent Pons, Mayor Marks, Dr. Frentz, our Tallahassee Memorial Representative, Mr. Jones, those who represent Whole Child Leon, the Leon County Health Department staff, and very importantly, those who now have left my side, but who are willing, the Students Working Against Tobacco, the SWAT team from Leon County, a fantastic group, and I hope all of you recognize how important they are to this work. We have basically, with tobacco an incredible problem. As a physician, I have the opportunity in the past to see patients. I have had friends who've been impacted by tobacco, and I think most of you have had the same kind of experience with someone you love or you care for who's been impacted by tobacco, not only because of the death, but because of the disease that it causes, because of the disability that it causes, because what it does to our quality of life. People don't even think about the fact that much of what we have in this nation that's due to heart disease is at its basis preventable just by getting control over tobacco products. They are a critical problem. The other thing that we're dealing with here, and I'm talking about our zero in the 95210, is sugary beverages. And I just want to ask this question of all of you. How many of you would sit down to a meal or have your children sit down to a meal where you took out the sugar bowl and commenced to eat 10+ teaspoons of sugar? How many of you, on the other hand, would drink a 12-ounce cola beverage? It's basically the same thing, folks. So a lot of this has to do with choices. Our SWAT team knows about that. They want to make the right choices, and they want to help their classmates make the right choices. And the groups represented here are groups that really are making that happen. So thank you all so much. Really appreciate it. I bring greetings from our Surgeon General, Dr. John Armstrong, who's delighted with the success and the role that you play in keeping not only our young people healthy, but keeping our population healthy here in Leon County. With that, I'll go ahead and introduce a friend of mine, and that is Dr. Homer Rice, who's our Leon County Health Department Director.
Good morning. It's actually my honor and privilege just to recognize what has already been done to a certain extent with 95210. 95210, the Picture of Health, is a project that began a couple of years ago. The Health Department initiated and then has taken off. It's taken off through a grant. The city of Tallahassee has really bought into this, and we really appreciate all that Mayor Marks has done as a spokesman, standing up and talking. We're going to try to get him out on the street waving a big finger for the 9, because he doesn't get 9 hours of sleep, he tells us, so we're going to work on that one. But we have really been able to create truly creative partnerships with this. Some of the people who have worked with us, besides Mayor Marks, are Dr. Kevin Frentz with FSU, Leon County Schools, Jackie Pons and his staff have worked with us to implement 95210 in the schools. Many of you may remember the children that we had up at the front screaming 95210. They're on a web video right now. And matter of fact, I went into Joe's office the other day because I heard somebody screaming and I thought something was wrong. And it was the children screaming 95210. So they're buying into this, and that's really important that we get the kids to understand what these numbers are and what these numbers mean. We want to thank Whole Child Leon. They developed a tracking system that is also web-based that they can use, or that we can use, to follow individuals and organizations to track them and their health behaviors online. COPE, the Childhood Obesity Prevention and Education Coalition, funded through the Blue Cross and Blue Shield of Florida's Foundation project, addressing childhood obesity, one of the big issues that we've talked about. Working Well has incorporated 95210 education to families through their employees and employers. The Tobacco Free Leon Partnership, doing collective work in tobacco prevention and cessation, and that work with the Tobacco Partnership is paying off. In Leon County in 2012, fewer children, fewer youth ages 11 to 17 were exposed to secondhand smoke. And from the participation here, you can see as an idea, more Leon County youth are active in SWAT than youth statewide in general. It's an extremely important program to get our kids to start early to know the dangers of tobacco. I want to recognize we've got Rick Bender here, who travels around the state talking to kids, explaining to them the dangers of tobacco and what he has gone through himself. So all of these people have contributed All of them are working to help us with zero tobacco, zero sugary drinks, but also the other things, the 5 fruits and vegetables a day, you know, the 2 hours of limiting 2 hours of screen time, the 1 hour of activity a day to make us a healthier community. Leon County is rated number 7 in the national statistics in the state of Florida as the 7th healthiest county. Through 95210 and programs such as this, I think we can go to number 1, and we're going to keep trying to do that. And now it is my privilege to introduce Raycon Williams. He's a freshman at Leon High School, and he's with Students Working Against Tobacco and a State of Florida Youth Advocacy Board representative. And he'll talk to us about the efforts of SWAT to combat youth tobacco use.
Good morning. I'm Rayquan Williams, a freshman student here at Leon High School. I am also a member of SWAT, Students Working Against Tobacco, where I serve as a statewide Youth Advocacy Board representative. SWAT is Florida's statewide youth organization working to mobilize, educate, and equip Florida's youth to revolt against and deglamorize big tobacco. SWAT is a united movement of empowered youth working towards a tobacco-free future. I joined SWAT about 4 years ago while I was a student at Griffin Middle School. I joined SWAT mainly because of the leadership opportunities that were provided to the members, and I wanted to prevent my friends from becoming tobacco users. Last year, I had the honor of serving as the chair of SWAT here in Leon County. Through hard work of past SWAT chairs, SWAT members, and the tobacco prevention program staff, we were able to have SWAT chapters in the majority of all public, middle, and high schools. This helped us maintain our goal of at least 200 SWAT members for the past 4 years. As we have continued to work towards a tobacco-free future, these past 4 years, SWAT members begun to work towards gaining policies to combat youth tobacco usage. Today, I am happy to report that the school board has created a comprehensive tobacco-free environment policy, and the Leon County Board of County Commissioners has passed a resolution urging retailers to seize the sale of candy-flavored tobacco. With the assistance of President Obama, passing the Family Smoking Prevention and Tobacco Control Act, which banned candy-flavored cigarettes, Leon County has seen a drop in youth cigarette usage. Sadly, we have seen an increase in cigar and smokeless tobacco uses, since they are still candy-flavored. Today, I must say to my peers, there is nothing good or cool about a candy-flavored death wish. I remember reading a statement from a tobacco executive which said, "We don't smoke that stuff. We reserve the right for the young, the poor, the black, and the stupid." This clearly shows that those who run the tobacco companies know not to use their product and clearly think of all of us as their customers are stupid. I encourage all youth in Leon County to stand up, seize control, and be the voice of your generation. We will not accept, support, or use Big Tobacco's youth-appealing products, nor will we become Big Tobacco's next potential customer. Thank you. Next, I bring you Mr. Dr. Kevin Fritz.
As the chair of the Tobacco-Free Leon Partnership, I'm proud to share that the mission of the Tobacco-Free Partnership is to empower youth as well as adults, and now this is critical, to mobilize and coordinate the resources of Leon County to create a tobacco-free community through youth prevention, cessation activities, promotion of tobacco-free lifestyle, and reduction of the tobacco industry's influence. There are 3 points of information I'd like to share with respect to this mission statement. First of all, there has never been a better time for tobacco use prevention. I've been working in this area for 10 years at FSU and 10 years before that, and just 10 years ago, the survey research that we initiated at FSU indicated that less than half of FSU students supported tobacco-free policies. Most expressed some serious concern about the rights of smokers. there's still that expression of concern about smokers, but it's had a significant shift. Students are now expressing a greater concern about their health and the right to clean air. And I think that's a critical transition that's been made, and we need to take advantage of that. Recent surveys, however, indicate that the support for such policies has greatly increased, with nearly 2/3 of students, faculty, and staff at FSU now supporting a tobacco-free campus. So we're at 2/3. And then, this is real telling, over 90% of parents surveyed would prefer to send their children to a tobacco-free campus. So all the people that have concerns about tobacco policy change, that's falling away. But another point I want to make is that we cannot rest. Experience has shown us that that ground is quickly lost without constant vigilance. You have to stay on top of this. If you rest for a minute, it's insidious. It comes back. So we must therefore work to continue building on this hard-won momentum. This is where the section of the mission statement about mobilizing and coordinating resources comes into play, which leads to my second point. As a result of working toward a tobacco-free campus for the past 6 years with the Breathe Easy program, the FSU Health Promotion Department and the College of Medicine have gathered a great deal of information about tobacco prevention and providing smoking cessation services, and we're looking forward to working together with Tallahassee and Leon County to create a tobacco-free community. So we don't want to stop at FSU, and we also understand, as CDC is understanding, the State Health Office understands, the College of Medicine understands, we can't do this alone. We can't be working just in the College of Medicine and having them do their thing and then the local community doing its thing. We're all in this together, because what we've seen is a lot of things that are effective with the SWAT program, somehow it gets lost in transition from middle school and high school to the college level, when all of a sudden you're exposed to roommates that are smoking, you're exposed to going out to bars and clubs where they're smoking, and next thing you know, people who had earlier decided not to smoke are all of a sudden tempted or involved. All right, and the part of the collaboration is most exciting to me as a health educator, as an educator, is the opportunity to coordinate the involvement of talented and enthusiastic students who are looking for opportunities to both gain experience and provide meaningful service to the local community. We have had some fantastic students coming forward with skills, knowledge, skills, and abilities that just amazes me. Over the past several years, a foundation has been built to harness and direct this talent and enthusiasm to help develop and implement both prevention and cessation services. So far, we have recruited students from the College of Medicine, College of Nursing, Student Government, Student Athlete Advisory Committee, just to name a few. And again, the quality and enthusiasm is rapidly building. We have all kinds of opportunities to bring students, graduate students and undergraduate students, to work in the local community. Where so many times we have internships at FSU and they go outside of Leon County and outside of Tallahassee. Why not have them serve the community and serve it so well? And in my last point, but not the least point, if you would like to join in this effort, please contact the Health Promotion Department at FSU. You can call me personally at 645-4973, or you can call the Leon County Health Department at 606-8176. Thank you. I'd like to introduce Vincent Irvin, who's going to give closing remarks. Thank you.
Good morning. I want to thank everyone for coming out today as we wrapped up this last tenet of 95210, zero sugary beverages and zero tobacco. I want to thank all of our speakers who came out this morning, and most of all, I want to thank our SWAT members and our soda and water for coming out and setting a good example for their peers, because it starts with our youth. Once we get our youth to live healthy lives, they grow into adults, and they are healthy adults, and then they get their children to become healthy youth and healthy adults. So with that being said, thank you and have a great day.